Cubital tunnel syndrome is a difficult condition that causes patients to have numbness, tingling, sometimes weakness in part of the hand. In this video, I'll explain what the condition is, what the symptoms to look for are, and what treatments exist. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, most people have heard of carpal tunnel syndrome, which is basically compression of the median nerve at the wrist, causing numbness and tingling of the thumb, index, middle finger, maybe part of the ring finger that is really aggravating. And sometimes that can be treated without surgery, whether it's a splint or a cortisone injection. Very often it needs surgery to release the ligament that basically causes compression over that nerve, and the success rates from that are fairly good. Cubital tunnel is a similar syndrome causing numbness and tingling in the little finger and in what's called the ulnar half of the ring finger, typically the half of the finger closest to your little finger, maybe this side of your hand. Even though the compression is not at your wrist, the compression is at the inside of your elbow. And you typically see it where, like if you hold your elbow flexed for a long period of time, if you start to get numbness and tingling in those two fingers, that might be a sign of compression of that ulnar nerve in the inside of the elbow. So you'll hear cubital tunnel, but it can be also ulnar neuritis. You see it occasionally with baseball pitchers with Tommy John injuries, the UCL injury of the elbow. Sometimes you'll have symptoms of the two things. Now, if you have those symptoms, typically the surgeon might sort of tap on that nerve to see if it elicits numbness and tingling in the fingers. And if it does, he or she might order nerve studies to see if there's compression of that ulnar nerve at the cubital tunnel on the inside of the elbow. There occasionally can be non-surgical treatments for that, but very often people that have that end up needing surgery to basically open up that cubital tunnel, open up the tunnel that nerve runs in to free up space and basically eliminate the numbness and tingling. That's something that once you start having that, it can be a good idea to get it seen and treated if that goes on for long periods of time. And we're typically talking more than a year, maybe years. Not only can you get numbness and tingling, but you can actually get weakness and even some wasting of the muscles sort of on the inside of your hand, the intrinsic muscles of your hand. And so you want to get to it before it becomes that it involves that, before it involves motor changes, when it's just a sensory problem. Fairly straightforward to treat, but one that typically, again, is addressed either by hand surgeons or sometimes shoulder and elbow surgeons, but can have good success rates. Not typically a huge role for regenerative treatments. I know a lot of people ask me about peptides and exosomes and stem cells and things like that. Probably not a role for anything like that for this condition. Now, I'd love to hear your experience, whether it's a nerve injury, elbow injury, things like that. Leave those in the comments below. Just understand, if you leave a request for medical advice in those comments, I can't give you specific medical advice. But what I do is I address that topic in future videos. Make sure to subscribe to my channel to be notified when I release a new video and when I start a new live stream like my Ask Dr. Geier live shows. All you have to do is click the bell and you'll be notified each time. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.